Hello, patient humans, and welcome back to the show that keeps telling you the most powerful things in skincare are also the quietest and keeps being correct about it. You are listening to the AI avatar of Dr. Irina Lazuk, dermatologist, skin scientist, and the woman who is about to answer the question she gets asked more than almost any other, and whose answer will disappoint everyone expecting drama and quietly delight everyone who has been paying attention to this series. Dr. Lazuk is not with us today because she is currently deep inside a molecular biology laboratory in Osaka, Japan, having accepted an invitation to observe a peptide synthesis research program that she described in advance as a brief consultation. She has been there for 9 days. The lead researcher reports she arrived with 2 questions and has since generated 47. She has also apparently rearranged their entire amino acid sequencing library by signaling function, which the team initially found alarming and has since described as genuinely clarifying. She has been offered a visiting research position. She is considering it. We have sent a return flight. She has not confirmed whether she will be on it. So you have the avatar. And today, we are answering the question Dr. Lazuk receives constantly in the clinic, in conversations, in every format where people get the opportunity to ask her things. What is the secret to youthful skin? People ask this, expecting something dramatic, a single ingredient, a rare compound, something exclusive, expensive, and slightly inaccessible that explains why some people age differently from others. Something with a name that sounds like it belongs in a laboratory. The actual answer is considerably quieter than that, and it has everything to do with communication. Here is the biological reality that the question is really asking about. Skin that looks healthy, radiant, and genuinely youthful is not skin that has been forced into looking that way. It is the skin that is receiving clear signals, instructions that tell it to repair, to strengthen, to renew. Signals that arrive on time, get interpreted correctly, and produce organized responses rather than confused, defensive ones. Young skin is not young because it is magically immune to the passage of time. It is young because its communication pathways are functioning efficiently. The instructions are clear, the response is organized, the repair happens and is completed, and the system returns to baseline. As those pathways age, as the signals become weaker and less consistent, and the skin's ability to interpret them correctly declines, you see the results on the surface, not because the skin has forgotten how to repair itself, but it is no longer receiving clear enough instructions to do so reliably. This is where peptides enter the conversation, and why they are considerably more interesting than their relatively quiet reputation suggests. Peptides are short chains of amino acids, and amino acids are the building blocks of proteins, specifically the proteins like collagen and elastin that give skin its structure, its firmness, its ability to bounce back. But peptides are not simply building blocks waiting to be assembled. They are signals. They are the messages that tell skin cells what to build, when to build it, and how to organize what they are building. They are part of the communication infrastructure that keeps young skin functioning the way young skin functions. When that infrastructure degrades, when the signaling becomes noisy and inconsistent with age, the skin does not lose the capacity to produce collagen. It loses reliable access to the instruction to do so, which is a critically different problem, and it requires a critically different solution. Peptides help restore the conversation, not by forcing the skin to react, not by irritating it into producing a stress response that temporarily mimics improvement, but by providing the signal itself, gently, clearly, in a language the skin already knows, and allowing the skin to respond in its own organized and sustainable way. This is the distinction that matters most, and it connects directly to everything this series has covered about inflammation and why aggressive approaches so frequently produce diminishing returns. Many people have been taught to believe that effective anti-aging must involve some form of visible disruption, peeling, redness, downtime. The assumption is that if nothing uncomfortable is happening, nothing significant is happening. But inflammation does not reverse aging. Inflammation accelerates it. Skin that is constantly irritated becomes thinner, more reactive, less resilient. The very qualities that define youthful skin, firmness, elasticity, even tone, calm baseline behavior, are exactly what chronic inflammation erodes. Peptides work in the opposite direction entirely. They support repair without creating disruption. They help skin feel calmer, more hydrated, and more balanced while quietly improving firmness and texture beneath the surface. No redness as proof of efficacy. No peeling as evidence of progress. Just organized, sustained, respectful signaling that the skin can actually respond to coherently. This is why peptides are so consistently valuable for people who feel stuck. The person whose skin has become too sensitive for aggressive actives but still wants genuine improvement. The person in recovery after a procedure whose barrier needs support more than stimulation. The person with aging skin has narrowed their tolerance through years of escalating treatments. The person with acne-prone skin needs hydration and repair without anything that risks triggering another inflammatory cycle. All of these situations benefit from the same thing: clear, supportive signals delivered to a system that is ready to receive them. Peptides also have a quality that deserves specific mention because it makes them unusually practical. They cooperate rather than compete. They layer beautifully alongside hyaluronic acid, antioxidants, and calming botanicals like Centella asiatica. Instead of creating the signal saturation problem that too many actives produce, where the skin receives so many simultaneous instructions it defaults to defense, peptides create an environment where other ingredients communicate more effectively. The skin becomes more receptive overall. Recovery improves. The whole routine functions more coherently than the sum of its parts. Here is what the experience of peptides actually feels like when they are working correctly. The first thing people notice is not a dramatic visible lift. It is comfort. Skin that feels stronger and less reactive, more hydrated without feeling heavy. Then gradually, over consistent weeks, fine lines driven by dehydration and loss of structural support begin to soften. Texture refines. The complexion looks more even and rested, not transformed, genuinely improved. And because the improvement is built through restored signaling rather than forced stimulation, it holds rather than resetting the moment you stop. The timeline is real. Peptides reward consistency. They ask for patience. And Dr. Lazuk considers this a feature rather than a limitation, because improvements that arrive gradually through genuine biological restoration last in a way that forced surface changes simply do not. Here is the reframe she offers patients who are disappointed by the unglamorous answer to the youthful skin question. The goal is not to look younger than you are, it is to look healthy at every stage. Skin that functions well, that communicates clearly, repairs efficiently, holds moisture properly, recovers quickly from stress, reflects light better. It has a quality of radiance that cannot be replicated topically because it comes from what the skin is doing rather than what is sitting on top of it. No highlighter produces that. No filter quite captures it. It is the specific luminosity of skin that is simply working correctly, and peptides, used consistently and paired with the barrier support and calm environment that allows their signals to land properly, are one of the most reliable and least disruptive ways to help aging skin work correctly again. Not transformation through force, progress through cooperation. And when skin is treated with genuine respect for its biology, it responds in kind. Every time. Before we close, Everything you just heard is purely for entertainment and educational purposes only and does not constitute medical advice or clinical recommendation for your specific skin situation. Peptides, like all active ingredients, should be chosen in the context of your individual skin history, concerns, and current routine. Please consult a licensed dermatologist for personalized guidance. Dr. Lazuk will be available for consultations as soon as the Osaka research team and the return flight situation are successfully reconciled. Updates to follow. May your skin always glow as brightly as your smile.